I mostly talk about bariatric procedures for adults, but in this video, I'm going to talk about bariatric procedures for teens. Is it safe? How to prepare for the procedure? And then I'm going to go into the procedure that I like to choose myself for teens, especially teens that are still growing. Hi, I'm Dr. Beltri from Beltri Bariatrics. I am a bariatric surgeon in the Orlando, Florida area. First of all, is it safe? Absolutely, it is very much safe. I do a lot of bariatric procedures in my patients that are still teenagers or adolescent. I find that there's a lot of things that need to be addressed before an adolescent or a teen has bariatric surgery. As you may know, there are certain consultations that need to take place. Number one, a consultation with a nutritionist. Okay. And I know there are a lot of nutritionists around, but I'm talking about nutritionists that specializes in pediatric patients, right? In teens, in adolescents, very important, because beginning to change your dietary habits very early on before the surgery is very important. Of course, the nutritionist is going to talk to you about your portions, how your portions are going to change. You're not going to be able to eat the same amount of food that you once ate. How the quality of food should change. What kind of food you should allow to eat, things that are healthy for you, the foods that have led to that particular teen being overweight, you're gonna need to avoid those things, the refined carbs, the sugary stuff. Very, very important also, a consultation with the psychologist, right? Very, very important that the parent and the teen that's thinking of having a surgery understands the necessary changes that they should make to make the surgery successful. Are there any psychological issues that need to be addressed? You know, sometimes obesity in teens is associated with depression. You know, is this being addressed? Is it being treated? Is it stable? And other psychological issues that can come up. Is there overeating or binging? These are things that need to be addressed, not only from a psychological standpoint, but also by the nutritionist as well, because it's going to dictate whether somebody does very well after the surgery. And of course, when I do bariatric procedures in teens and adolescents, I talk to their pediatrician. I mean, have they tried any weight loss programs in the past? What kind of programs have they tried, and did it work? Once that teen, that adolescent, it's ready for surgery, they've seen the psychologist, the nutritionist, everything checks out fine. They have started making certain changes. They have gone through the pre-op diet, pre-op exercise program, getting ready for the surgery. Then comes the procedure itself. What do you do? I'm going to talk about what I personally do, okay? When I operate on an adolescent or a teen, I tend to choose more of the gastric sleeve or the sleeve gastrectomy. Why do I choose this procedure over the gastric bypass or the duodenal switch? Just because the gastric sleeve is a much simpler procedure, quicker recovery, but more importantly, my patients might still be growing, right? Might be in your early teens. And you might still be growing. The gastric sleeve doesn't really affect absorption of nutrients, and proteins, and things like that, and macronutrients to the extent that other procedures like the gastric bypass and the duodenal switch do. So therefore, I tend to choose a simpler procedure like the gastric sleeve that will give you excellent weight loss if it's used appropriately. Also, one of the reasons why I like to choose a gastric sleeve, and probably one of the main reasons, is because teens and adolescents still have a lot of years to live, right? You might be in your early teens, late teens, but you may get married later, may have children, which are things that can cause you some of your weight to come back. And if you started with a bypass or a duodenal switch, you might not have that many options anymore, right? Whereas if you had a gastric sleeve and now you find yourself in your 30s, mid-30s, regain some of the weight back, all of the way back, where you still have options. A sleeve can easily be turned into a gastric bypass or into a duodenal switch, which is what I prefer to do because it's much better weight loss from going from a sleeve to a duodenal switch. But those are the main reasons why I like to do it. So I hope this answers some of your questions regarding bariatric procedures in teens. If you have any more questions, you can always visit our website, sayno2obesity.com. Again, I'm Dr. Beltri from Beltri Bariatrics. I'm a bariatric surgeon in the Orlando, Florida area. Thank you very much.